Bone fractures cause excruciating pain and mental agony. Additionally, fractures result in extended immobilization. The goal in managing fractures is to ensure that the involved limb segment, when healed, has returned to its maximal possible function. Caesar's quadrangularis is a traditional medicine usually said to come from Ayurveda and has been proved scientifically to hasten fracture healing. Several constituents present in Caesars, commonly known as bone setter, promote fracture healing. This drug majorly contains ascorbic acid, carotene, calcium, anabolic steroidal substances, beta-sitosterol, delta-amarin, delta-amaron, flavonoids, terpenoids, curactin, resveratrol, phytesterol, and many other compounds. Caesar's quadrangularis speeds bone healing by acting as glucocorticoid antagonist. The anabolic and androgenic properties of the drug is due to the anabolic steroids present in it, which act on the estrogen receptors of bone cells, thereby increasing the osteoblastic activity and facilitating healing of fractured bones. Studies show 40% reduction in fracture healing time when Caesars was used. The treated group showed recovery within 4 weeks versus 6 weeks in the control group. Caesars also leads to much faster increase in bone tensile strength. Restoration of 90% normal strength with Caesar's quadrangularis treatment at the end of 6 weeks as compared to 60% with the control group was observed. Caesars also improves the symptoms of fracture such as pain, swelling, tenderness and mobility from the first week of treatment. Calcium has positive impact on bone forming and bone resorbing cell activity. Vitamin K also has a crucial role in bone metabolism. First, it facilitates carboxylation of osteocalcin, which helps calcium to bind to the hydroxyapatite matrix of bone, and second, it decreases urinary calcium excretion. Clinical evidences has shown that supplementation with vitamin K results in reduced bone loss and preservation of bone strength. Treatment with vitamin K showed callus development along with highly mineralized primary bone formation. Let's now understand from Dr. Ram Prabhu his experience using Caesar's quadrangularis.
I have been using Caesar's quadrangularis since almost 35 years. My teacher, Dr. Baudekar from KEM Hospital, JS Medical College, was fond of this molecule and I have been using it for fracture treatment. This molecule has been known for almost 100 years or maybe a couple of centuries, and this has been always used for healing of the fractures. I use it for especially complex situations, for delayed unions and non-unions, and I have found it extremely useful in orthopedic practice. The advantage of this Caesar's quadrangularis is that it does not have any side effects. It could be used in males and females, and it can be also used in various different comorbid conditions like patients having diabetes, hypertension and some other endocrinal problems. We also use this molecule, and this can be used in pediatric age groups around the age of 10 to 15 years without any significant or any side effects for that matter. I have used it extensively in last 6 to 7 years, and I found it to be extremely useful in managing trauma. It is also useful perhaps in normal fractures to enhance the fracture healing. Caesar's quadrangularis should be used for minimum 2 months to 3 months. The dosage recommended is 1 tablet 3 times a day, which could be increased or decreased depending on the situation. But I have used this in couple of cases for more than 6 months also. Another advantage of Caesar's quadrangularis is there are no drug-to-drug interactions, and this could be safely used with other drugs, especially in the cases of diabetes and hypertension. We could use this along with the drugs which have been given for those conditions.
It's thus clear that Caesar's quadrangularis is an extremely useful adjuvant in fracture healing, hastening healing and early recovery. and the combination of Caesars with calcium carbonate and vitamin K-7 would enhance its benefits. This film is brought to you by Alembic Pharmaceuticals, makers of Cobuilt Total and Cobuilt.